In growing up, we grew everything we ate. We harvested in the springtime. We processed what we could. It was healthy. I'm Judith Welch Smith and a member of the Bird Clan, one of the last remaining full-bloods of the Eastern Band of Cherokee. A third of our people are diabetics. Being on a restricted diet, you have to have certain foods. And to get my groceries that I need, I have to travel 62 miles one way.
The koala boundary is really in a food desert. And so when you bring food into a community and you offer them that gift, it can really allow people to bloom in other ways.
The Produce Prescription Program is spearheaded by Cooperative Extension and Mountain Wise, and they chose Vecinos and the Cherokee Indian Hospital as pilot programs. A lot of our patients are migrants, are leaving a lot of times at 6 in the morning, and they go work in the fields until sometimes 9 or 10 o'clock at night. And that coupled with a non-nutritious diet, you get bad health outcomes. A lot of times in our patients, we see diabetes, pre-diabetes, and one of the biggest things that we tell them is to work on diet and exercise, and then we'll reevaluate them in 3 months. What we found is that we didn't have resources to support that statement of this is how you're going to work on diet and exercise.
What these food boxes do is it takes away the stress, it takes away the wondering, where am I going to get healthy food? And we just want to look at our people and say, hey, we have everything you need in this one stop here.
We're not just giving people food, we're teaching them how to cook it. On top of that, we're making sure that people have the means to get to our classes and pick up their boxes by giving them gas cards. And if they want to stay for a class, we have childcare for them.
Esta clase aprendí a cocinar muchas comidas rápidas, ricas y nutritivas. Entonces, para mí, yo pienso que la mayoría opina lo mismo, que es algo muy bueno y que más que nada nos está ayudando a nosotros como en el cuerpo a cuidar la salud.
Each month that I've been in this program, my A1C, it's come down a level. I've learned to cook different, and with the different recipes, it's been a very good help. I recommend it to other people who are diabetics also. So I share the information that I've learned.
Just tonight, I just had a quick moment with one of our male participants, and I said, how did it go? How was the program? And he started telling me a recipe right off the top of his head. So that was kind of like, yes, we did it.
Something about the excitement and passion around people learning about food for their health together in a cohort of people who are from their community in similar situations, it's just so tangible and it's so vibrant, and it's that kind of programming that gets people excited, and it's that type of programming where we see lasting changes.
As a nurse, I know that food is medicine, and it is the very building block to health and wellness. And there's really nothing more nutritious than local and fresh.
Everyone can benefit from locally grown foods, and all farmers who serve those communities can benefit from having an audience who understands what to eat when and how to support their businesses, because that will support the community and the land that community sits on.
These produce prescription programs are going to allow farmers to come together and co-op each other's products and put them in a box and go straight to families' houses in this region. Fresh food that they can really appreciate and enjoy with their family.
We already see the connections being made. We already see the kids are like, oh, when are we going to go get our healthy food box? You know, they know that it's a healthy box of food.
Every week, more and more kids showed up in this cooking class, and it was just so beautiful to see these kids wanting to take part and their families wanting them to be there. And it was just such a communal thing to see everybody cooking together. I'm not going to forget that.
For every one person you enrolled, 4, 5, 6, 7 people from their household were engaging in the program. To me, that says not only can this program be scaled up, we should be thinking about how to scale it up.
One of the long-term impacts would be reaching people that otherwise are not reached. And the model that we have here in this program is low investment on the patient's part and high return in their health and the health of their family.
Tiene buen resultado y he tenido cambio. Las comidas del programa me está cambiando y está mejor.